Everybody, it's Punk Rock Soul Sister here, and I am here today to do an update to my gallbladder surgery video. This is actually a requested video. Mr. Truth Forever requested that I do an update on how I've been doing since I got my gallbladder out 2 years ago, and whether or not I think it was a good idea that I had it done, etc. So I wanted to apologize. I'm in my car because I've been really busy and I've been sick. I've got allergies or something, so you might notice my voice sounds a little bit nasally. And I am in my car on a very hot day with dump trucks outside, so I hope you can hear me okay. And I have my windows up and I'm starting to sweat, so I apologize for looking a bit shiny and all that. But I got the gallbladder surgery in 2012. I had been having attacks, not very often, but enough that I was having to go to the emergency room a couple of times, not knowing what was wrong with me. So yeah, I felt like I needed to get something done. Now, my attacks were brought on by certain foods that I ate, and there was the option to just stop eating some of those foods, I guess, but for example, I love cheese. Cheese is very high in fat, but I love cheese. I always have, and if I couldn't have cheese anymore in my life, I don't think it would be worth living. I know it sounds crazy, but I like cheese, and so I did not want to give up some of the things that I liked, and so having the surgery seemed like a good alternative. Now, some people might think that's crazy because when you have a surgery, you always open yourself up to the possibility of something going wrong or it not turning out the way that you expected. And so that's kind of what this video is about. I just want to talk a little bit about post gallbladder surgery. It's called cholecystectomy, and there is something called PCS, post cholecystectomy syndrome, and it is a real thing, I guess, in terms of people having problems with their surgery or with their bodies after the surgery. And so I have some notes here that I just kind of wrote down that it describes the presence of symptoms after this PCS, this syndrome. And of course, now the syndrome isn't a real thing because whatever you have after is probably its own thing. For example, some people report that they have irritable bowel syndrome after they have gallbladder surgery, IBS. I have not had any problems with that whatsoever. Not to get into too much detail about my bowel movements, but they're generally pretty much the same as they were prior to the surgery. Now, sometimes when I eat a lot and it's high in fat, I find that it is a lot looser and a larger amount than it used to be. Sorry to get into that. That's kind of gross, I know, but that's part of what this is about. Because what happens is your gallbladder stores the bile, and when you don't have that anymore, then small amounts of fat, I guess, get into your small intestines rather than sitting in the little gallbladder that was holding it before, and it can cause some problems to your digestion. So having different problems with digestion could be possible after the surgery. Basically it says PCS is caused by alterations in bile flow due to the loss of the reservoir function of the gallbladder. Two types of problems may arise. The first problem is continuously increased bile flow into the upper GI tract, which may contribute to esophagitis and gastritis. Now, I do have a little bit more what could possibly be acid reflux than I did previously. I actually didn't used to have acid reflux. I got it when I was pregnant really bad, but I didn't normally have it. I get that a little bit more sometimes depending on if I like lay down right after I eat. And also, especially, the biggest thing I've noticed about a change after the surgery is when I lay on my back my stomach gurgles. It's really kind of strange. For a while, I really felt like my organs weren't in the right place after it was gone, if that makes any sense. It felt, for a good year, I'd say, it felt like something was missing. It felt really strange. And until probably recently, like whenever I'd lay on my back, I would get this bubbling and gurgling in my stomach. And so I don't sleep on my back anymore, for one thing. And I don't know, there's nothing in here about that, but let me know if you've had any problems like that. And I'd be curious to know of any issues that anyone else has had. I have not had, excessive diarrhea or anything like that. They say that some of these symptoms can happen in about 5 to 15% of patients. And then some were even saying up to, I think one source said, even more, said 5 to 40% of patients can have symptoms that are that can be transient, persistent, or lifelong. And some of those symptoms, are upset stomach, nausea and vomiting, gas, bloating, and diarrhea, and persistent pain in the upper right abdomen. I haven't experienced most of that. I can say that the thing that caused my attack, one thing that had caused my attack prior to the surgery, was Jimmy John's sandwiches, the vegetarian sandwich, which is a lot of cheese. And I thought a couple times since then, I thought, oh, well, maybe it was the mayonnaise, because they put a ton of mayonnaise on there, and mayonnaise is really high in fat, regular mayonnaise. And so I try to get it without the mayonnaise, but I still have problems eating that. I still either get that really loose stool after, or I actually this time got a pain, almost like a gallbladder attack again. It wasn't anything like the attacks were before, but it was a pain, and it eventually went away. And so I really should stay away from those sandwiches, first of all. So changing your diet, that's the big thing. I think that's the big thing. If you can change your diet and avoid the things that cause these problems, you'd be much better off. If you're like me and every now and then you think, well, maybe it won't affect me this time, then you may have to pay a price. It's not going to be anything like, I don't think, having a gallbladder attack. So it comes down to, do I think I did the right thing? Yes, yes, yes. I have no problem with feeling like I got a surgery that didn't help me or made me worse. No, I don't feel like that at all. I feel like the surgery did help. I know that some people left some comments for me, and I don't know if these are spam and people, just crazy people, but about some other alternatives. I forget what it was called, but I mean, if you're interested in that, you can look at some of those comments. I go ahead and put them up there. I don't delete them thinking they're spam, because maybe what they're offering does work for people. But for me, I think that getting the surgery was a good idea, and I have no regrets. So maybe I'm lucky in not to have really any serious complications. The other thing is that when you get surgery, like I said, you're opening yourself up to other possibilities. You could get some type of infection or something like that. I had a laparoscopic surgery, so they're much better, I would say, than the open, they call them open gallbladder surgery, where they actually have to cut you open and then go in. So if you can, I would definitely try to go the laparoscopic route. And if you have any questions, I mean, it was a couple of years ago, and I mean, it's really in the past, and I've probably forgotten most of the negative things about it, but I still have scars, but I had scars anyway from C-section, so that's not that big a deal. Hopefully this was what you were looking for, and hopefully this helps somebody, and I really appreciate you stopping by, and thanks a lot. Talk to you later. Bye.